viewers, this is Fruits of the Womb, where we discuss health issues related to pregnancy and child health. My name is Dr. Vera Bayu, and I'm your host. Have you ever heard about diabetes in pregnancy? Did you know that some women develop diabetes when they become pregnant? You don't want to miss today's episode. We'll go on a quick break. When we come back, we'll delve into the issue. Stay tuned. So welcome back. This is Fruits of the Womb, brought to you by kind courtesy of Cousins Baby and Camel Baby Antiseptic. Remember to stay interactive. Join us on our Facebook page. Go to Facebook, type Fruits of the Womb, and you can post your questions, comments, or contributions, and we'll do well to attend to them. Today we are discussing diabetes in pregnancy. What exactly is it? How do pregnant women get diabetes? All there is to know about it. And I have two wonderful guests in studio today. On my extreme right is Mrs. Sophia Ametepe. She's a dietitian with the Korle Bu Teaching Hospital. And on my immediate right is Dr. Titus Bayu. He is an obstetrician gynecologist with the Korle Bu Teaching Hospital. You're welcome.
Thank you.
So diabetes in pregnancy. It's sometimes referred to commonly as gestational diabetes.
Okay.
What exactly is this condition? Dr. Bayu.
All right. Once again, thank you for having us. Diabetes is quite common in pregnancy. And diabetes in pregnancy is not too different from diabetes in the normal population. But if you say a woman is diabetic and is pregnant, we can classify it into two broad types, where the person had a diabetes before becoming pregnant, that is, you are known to have diabetes already, or the gestational diabetes, which is a diabetes that is diagnosed during pregnancy. You were not previously diabetic, but you just became pregnant, and then in the course of the pregnancy, you've been diagnosed with diabetes. So what exactly is diabetes itself? It's a chronic metabolic disorder which is associated with a disorder of metabolism of carbohydrate, basically. So,
now you are confusing my
yes, to bring it down, in simple terms, it means that the person is not handling sugar or glucose well in the blood. So either the hormone required to take glucose from her blood into the tissues is defective or not working at all. That's the insulin. Okay. Or the body is not responding well to this hormone. So that's basically what it is, so that they most commonly have a higher level of sugar or glucose in their blood compared to other people. And sometimes when they get it low, it actually goes too low than what is expected to be. So they have a problem keeping a stable sugar level within their blood. That's basically what the condition comes down to.
So Sophia, what are the risk factors, or what's the cause of this problem in our pregnant women?
Okay. So there are a number of risk factors, but the very common ones are women who are either obese prior to pregnancy or may have been in a normal body mass index, meaning that their course of pregnancy height was ideal. Yes. But in the course of pregnancy, when people think about pregnancy equals eating for two, so a woman would gain excess weight in pregnancy.
But Sophia, when you are pregnant, you are eating for two. And if you are carrying twins, you are eating for three.
That's what a lot of people think, but it's far from it. You just need a slight addition. That's just about 300 translates, and it doesn't translate even to half of what you should eat on a normal basis. So yes, you need to gain weight, but you should do it within the recommended range. The other thing too is advanced maternal age. So some women are giving birth at later ages, and that is also a common risk factor. The other one has to do with race. So African Americans, Asian Americans have been linked to have an increased risk for this gestational diabetes. For some women also, one of their deliveries had a baby whose weight was more than 4 kilos. So that also predisposes them. And
so having a big baby is a problem.
A big baby is a problem. So
because we seem to be happier when the baby is bigger.
Culturally, we are also big. We are happy. all those things are not the best, so we have to look at it. And then some women also are hypertensive, and that is also another common risk factor. Yeah.
All that she's rightly said. And also, if you have a family history of diabetes, your risk of becoming diabetic while pregnant is also a bit high. And in some people, they may have a history of recurrent stillbirth. They get pregnant, the baby suddenly dies. They are miscarrying frequently, or earlier part of the pregnancy, they are miscarrying frequently. It may all be signs and symptoms, or let's say risk factors that you would have diabetes in this pregnancy, or you have had diabetes which has not been diagnosed. And then this may be manifesting on until somebody finally makes the diagnosis.
We'll talk about how the diagnosis is made later, but what are some of the signs and symptoms?
Okay, so like I said, the signs and symptoms comes down to the basis that sugar control is a problem. And so when sugar control is a problem, there are signs and symptoms that the mother may show. And there are also signs and symptoms that may show in the baby. So if you take the mother who is pregnant and having diabetes, the common ones is that the sugar suppresses the immune system. So they have recurrent infections, recurrent urinary tract infections, recurrent boils, and then they may get recurrent vaginal candidiasis and stuff like that, vaginal discharge happening severally. Then you may have a mother who, because of the poor control, poor immune system, they may also they filter a lot of the sugar into their urine. So they urinate a lot, and in terms we'll say polyuria, large volumes of urine and frequently. Then as a result, they are also drinking a lot. That's also polydipsia.
The challenge with that is during pregnancy, a lot of women urinate more frequently than they used to before.
Yes, there is an explanation for that. The pregnant uterus actually lies in most people on the bladder. So it compresses on the bladder. So
the bladder is where urine is stored.
Yes. So the uterus, you are more on the bladder, so you are more likely to have the air to urinate frequently. However, the urine under those circumstances, the volumes are not a lot, and there is no pathology or a disease associated with that one. But certainly, if you have to wake up more than 6 times to urinate at night, that is problematic. If in the daytime you are urinating 10 times, 12 times, and the volumes are large, then there is a problem there. And then you are drinking equally a lot. And some people think that, oh, I urinate because I drink. But later, when we go into the complication, you realize that there are devastating effects of this. So instead of just taking it that, oh, it's just because I'm pregnant, that's why I'm urinating a lot, I think it should be checked. So if you urinate a lot, you drink a lot, you eat a lot, like Sophia was saying, and then you think you're eating for 3. No. So polyphagia, just eating so much, is also a sign of the diabetes. And then when as the pregnancy goes on, weight gain. You began a pregnancy with, let's say, 70 kilos before you realize you're 100 kilos. That's excessive weight gain. Normally, we expect most pregnant women to gain between 8 to about 12 kilograms in the course of the entire pregnancy. So if you gain about 16 kilograms, 20 kilograms, there is a problem. So excessive weight gain may also be a sign. And sometimes, if it's not diagnosed throughout, then at birth, large babies, where our society people are happy to help you carry a big baby. Yes, if you have a small baby, nobody wants to touch that baby. Yes, it may actually not be a good sign. So it may be a sign of uncontrolled diabetes in that pregnancy. And then also episodes of hypoglycemia, where the woman feels tremors, there are what looks like hunger pangs, you are shivering or, not stable, let me put it that way. That also can be a sign of diabetes.
So I guess when you go to the antenatal clinic and your weight is checked at every visit, it's one of the reasons why your weight is checked. And I think those at the primary health care level also need to understand that you're not just checking the weight for checking's sake, but you are checking the amount of weight gain
during that pregnancy.
If the woman is gaining too much weight, then it may be a problem.
Yeah, and I think just to add to that, a study done in Colombia shows that even if you have an absolute weight more than 90 kilograms during pregnancy, your risk is high. So at any point in time, they check your weight and your weight is more than 90. It gives some risk, which means that they need to monitor you a little more.
Sophia, so how is the diagnosis made?
Okay. So more often than not, what we'll do is to give a woman 75 grams of glucose solution to drink. When the woman drinks, usually prior to drinking this glucose solution, she's asked to fast for at least 8 hours. So the
For 8 hours. Yes, woman fasting for 8 hours. Yes.
Yes.
Oh, it's just an overnight fast.
Your last meal will be probably
Yeah.
between 6 and then take a bed.
But you know, some people wake up at dawn to eat because
No.
they are hungry.
But for
The baby is hungry, not the
Yes.
mother.
No, on the day of the test,
First,
you should
need
eat.
to sacrifice, yes.
For the
your
sake
own
of
good,
yes.
yes. So the mother will check the baseline of the mother's sugar level or the glucose level when she hasn't taken the solution. So that is what we refer to as the fasting blood sugar.
Yeah.
So we are expecting that the mother will not get above 5.1 millimole per liter.
Yeah.
If she gets anything above 5.1, then we know that there's a problem. She will take this 75 grams of glucose solution. After an hour, we'll recheck the glucose level, and we are expecting that she will not exceed 10.0 millimole per liter. We check it also after 2 hours, and the mother should not exceed 8.5 millimole per liter. So with all these three indices, once the mother exceeds one of these three, then we diagnose that this woman has gestational diabetes.
So from what you are saying, it seems the levels for pregnant women are expected levels for pregnant women are lower than for general diabetes, because
Yes.
most people would use for
the fasting
for
like
fasting
7.
6 or 7
Yes.
to make a diagnosis.
Yes.
And for the random blood sugar, that's the sugar that test that is done when the person has eaten above 11.
Yeah.
So it means that for pregnant women, the values are lower for diagnosis.
Yes, and rightly so, because there's an explanation for that. In pregnant women, it's been shown that the high sugar is actually very toxic to the baby. So we need to maintain the control tight. What may be normal for an ordinary person walking around, in the pregnant woman, the complications that a baby may suffer just for that value is so significant. So that is why the values have deliberately been reduced for pregnant women, to make sure that there is no episode of very high sugars, because it's actually feticidal. It can kill the baby. In the early part of the pregnancy, it's teratogenic. It can be associated with a lot of complications I'm sure we'll talk about later. Yeah.
And we'll talk about those complications after the commercial break. So you don't want to go anywhere. Stay tuned. This is Fruits of the Womb. Welcome back. This is Fruits of the Womb, brought to you by kind courtesy of Cussons Baby and Camel Baby Antiseptic. Remember to join us on our Facebook page. Go to Facebook, type Fruits of the Womb, and you can post your questions, comments, and contributions. And we will answer all your concerns. If you have questions about this topic or any other topic or any other health issue, you can just post them there and we'll take a look at them. Well, we are looking at diabetes and pregnancy. And before we went on the break, we talked about the signs and symptoms, how the diagnosis is made. Sophia, what are the treatment modalities available for women who are diagnosed as having diabetes in the course of their pregnancy?
Okay, so the treatments can be broken down into 3 main components, but it may not be 3 for everyone. The first and foremost being diet therapy. So a woman who has been diagnosed to have this condition will be referred to a dietitian who would sit down with the patient, will take the patient's history, see how the person eats. That's what we call the diet history. And then we'll plan out a meal for the patient, looking at making the meals and snacks very regular. We always advise that the patients have 4 to 5 hour interval between their meals to prevent any form of hypoglycemia. That's it. Glucose levels going too low. We also look at the components of food. So what we always say is that the diabetic diet is what we call the healthy eating diet, which should be across board for all of us. Unfortunately, most of us are not eating healthily, so the diet sounds way out of our league. But when we look at the diet, we are looking at carbohydrates, and not just any form of carbohydrates, complex carbohydrates, meaning whole grains enriched with fiber. These are going to regulate the rate at which the food, when it digests into glucose, would enter the bloodstream. We are also concerned embedded in carbohydrates are fruits and vegetables. Fruits we know to be healthy, but we should remember that fruits are also natural sources of sugars. So we always advise the patient to take a portion at a time. A portion means, for instance, an apple, 1 medium size of apple, or for banana, two small fingers. So if you go eating a bunch of bananas, your sugars are really going to go high.
So far, what if the baby wants a whole bunch of bananas?
No, the baby will never want that. You could have a greater number throughout the day because you have 3 servings or 2 servings of the fruits, but not at a time. The vegetables are also very important. They also help regulate the blood levels. When we come to our proteins, so with our protein, if we look at meat, we are advising that patients should go in for lean meat instead of the ones filled with so much fat. And then even with our cookies and oils, they should be in moderation. So you don't cook your food or have your soup and there's so much oil floating on the top. All these things contribute to excessive weight gain. And that is when all these things are also going to increase your risk of having this diabetes in pregnancy. The other thing has to do with medication. Some people are put on oral hypoglycemic agents, so like metformin. So those are tablets that the patients are going to take. But in extreme cases, sometimes the body is producing the insulin, but the body is naturally resistant, not making use of the insulin in any way. So we have to give these patients insulin directly. So that would cover for some aspects of the woman. But exercise, so diet, therapy, the medication, and then exercise is what we always advocate for everybody. But the exercise will be restricted or not allowed in people who have conditions that do not allow them to move around. They are strictly supposed to be having bed rest. Then for that we limit it. But these are the 3 main focal areas.
Okay. So Dr. Bayu, can you briefly take us through the complications?
Okay.
What happens if a woman doesn't get the required treatment as Sophia mentioned?
So because of time, I'll just summarize the complications to say that there are very devastating complications of diabetes immediately in the pregnancy and long term. For the baby, I'm sure you've discussed some other conditions on this show that diabetes have been mentioned. From congenital heart problems, from the brain, microcephaly, hydrocephaly, all, congenital abnormal head, big head, yes, congenitally abnormal heart, the gut, that is the intestine, may not develop well. You can have
diabetes can do all this.
Yes, from head to toe, there can be complication everywhere for the baby. Yes, and for the mother, we also have complications. And these complications may be the fact that they are prone to genital tract lacerations, they are at risk of a cesarean section because the baby is big, and then also the fact that the long term, the mother can develop normal diabetes, which is not gestational diabetes. Ordinarily, gestational diabetes should stop when your pregnancy is over, but it may continue and become adult onset diabetes or type 2 diabetes, and then you may become diabetic for life. So that's another complication. And then you have the risk of having diabetic pregnancy subsequently. So all these are possible complications that can occur to the baby and to the mother. The most feared complication to the baby, if you put all this aside, is sudden fetal death. If you hear a pregnant woman is there, goes to clinic, everything is fine, and he comes another time, the baby is dead. It may just be diabetes. So these are some of the complications for which reason you must take the treatment that has been given. Diet, exercise, and then pharmacotherapy, that's drugs, if it becomes necessary.
Are some women missed? Is there any form of screening for pregnant women?
So
briefly?
Just in a word, diabetes in Ghana is significant in pregnancy. About 10% of our pregnant women are diabetic. 1 in 10, which is significant. So ideally, we should screen every woman. The standard test that Sophia described earlier, which is the OGTT, is used in some countries that have enough resources to screen everybody. We do not have the resources to screen. So we check their urine, we look at their history, and all those things to tell those who may be diabetic. So when a pregnant goes to the clinic every time, it may, if there's glucose in it, it may identify a woman who needs further testing. So antenatal attendance is the first form of screening. so that it may be picked up and further testing done to show that you are diabetic.
So the urine tests are useful.
Very useful. So don't complain. It's not just because the nurse wants money or the midwife wants money, but it's to help us.
So viewers, as you know, every week there's a question we ask, the question of the week, and if you answer right, you might win a prize from our sponsors. So for this week, the question is:
excessive weight gained during pregnancy is healthy. A. True. B. False.
Send your answer to the number on the screen. Let's check out last week's winner.
All children should be able to form a sentence by 2 years. The answer is B.
Congratulations. So as usual, time runs at a supersonic speed. But before we go, your final words to viewers about this. I'm sure they would want to ask more questions. And viewers, feel free to go to our Facebook page and post your questions if you have any questions concerning this topic or any other topic. Sophia, your final words.
The antenatal period is very important because that's when some of these conditions such as gestational diabetes, as we've described, can be picked up. So let's not see it as bothersome or a waste of time. Let's pay attention and save ourselves and our babies from various devastating complications. Thank you.
Thank you, Sophia. Dr. Bayu.
All right. So my final words is that the diagnosis of diabetes is not doom. Ensure that you comply with everything that you are told, and you should be fine as well as your baby.
So viewers, this has been Fruits of the Womb, and some final tips before we go. Remember that gestational diabetes is here. It can happen in any pregnant women, occurs in about 10% of pregnant women. Risk factors include advanced maternal age, increased weight gain above usual, and a family history of diabetes. Ensure that you are screened at least once during your pregnancy for diabetes and have your urine checked at every antenatal visit. So this has been Fruits of the Womb. I hope you've learned a lot. Next week, we'll be here same time, and I hope to see you all. My name is Dr. Vera Bayu, and I've been your host. Remember, God loves you. Stay blessed.